Hello, everyone, and welcome to this month's Clean Sport Education webinar. Thank you for joining us from wherever you are in the world. My name is Armand Urban, a member of the education team at the International Testing Agency. As we approach the end of the year, it's important that athletes and athlete support personnel understand what is new in anti-doping in 2025. Before we go any further, allow me to do some housekeeping. We offer translation in 4 languages: Arabic, French, Russian, and Spanish. Please use the interpretation button on your Zoom menu to pick up your preferred choice. We will be answering your questions live at the end of the session, and you can write them at any time using the Q&A button on your Zoom menu. And please note that we are recording the session. I'm pleased to offer our thanks to our official presenting partner, Informed Sport, whose support allows us to deliver our webinars free of charge to the clean sport community. Informed Sport is a global certification program for supplements that batch tests products for substances prohibited in sport. As supplement contamination continues to be one of the leading causes of inadvertent doping, we encourage athletes and athlete support personnel to check all products before use at sport.wetestyourtrust.com. Now, I'm delighted to welcome our panelists for today's session, Dr. Mark Stuart and David Healy. To start, I would like to introduce David. David is the WADA Medical Science and Medicine Senior Manager, and he has been with WADA since 2018. His background includes extensive experience as a sport pharmacist at multiple international events, including the Rio 2016 Olympic Games. Welcome, David. It's a pleasure to have you with us today, and good morning to you in Canada.
Thank you, Armando, and thank you to the ITA for inviting me today. I'm sure we will have a very useful and productive webinar for everyone listening.
Thank you, David. Next, I would like to welcome Dr. Mark Stuart. Dr. Stuart is the Drugs, Health and Development Senior Manager at the ITA. Importantly, for today's discussion, he is also a sports pharmacist with extensive expertise in sports pharmacology. Mark has led the pharmacy operations at over 16 sport international events. Mark, welcome to the webinar, and thank you for joining us.
Thank you for the introduction, Armando. Right, well, today I'm going to give an overview of the list of prohibited substances and methods, and especially some of the new changes that will come into effect on the 1st of January next year. So the Prohibited List is the international standard published by the World Anti-Doping Agency that defines what substances and methods are banned in sport. Now, as an athlete, it's very important that you know where to find it and are familiar with what's on it so that you know how to check whether the medications you plan to take are prohibited or permitted in the sports that you compete in. Now, the list is a constantly evolving document and updated at least annually, so it's really important that you always check for any updates. Now, WADA publishes the version for the upcoming year in October, which comes into effect on the 1st of January. Now, occasionally changes are made mid-year, so if you need to take a new decision about whether to take a medicine, always refer to the WADA website for the current list, so you're basing that decision on the current rules. So how does a substance get onto the list? A new substance or method can be added to the prohibited list if it is deemed to meet 2 of the following 3 criteria. So firstly, it has the potential to enhance sport performance. For example, that they can make the athlete run, swim, or compete faster, or for longer, or lift heavier weights, or feel less pain, so they can push themselves a little harder. Secondly, that the substance or method represents a health risk to the athlete. Now, many of the drugs fall into this category based on some of the serious side effects they have, or the impact on health. For example, anabolic steroids can have serious cardiac side effects, which can result in an increased risk of heart attack. Now, some of the narcotic drugs, such as heroin or fentanyl, have a serious risk of addiction, and marijuana use has known and widely documented health risks for users. Lastly, that the use of the substance or method violates the spirit of sport. Now, the spirit of sport really covers many concepts, but in essence, it is the values relating to ethics, and fair play, and honesty, and respect for the rules and laws and of your other teammates. And I always say if something is being used with the intention to cheat, then it's probably going to be against the spirit of sport. Now, this is an overview of the sections of the prohibited list. You can see that it consists of substances and methods prohibited at all times. That is every day of an athlete's life, including when they're not competing. It also has a section with substances prohibited only during the in-competition time, which is from midnight before your event until the end of the doping control process. Now, it's important to note that WADA may approve for particular sports an alternative definition, and you should always check with your international federation what the definition for your particular sport is in terms of in-competition period. And you can also see on the prohibited list that it also has a section that describes substances that are only prohibited in certain sports. Now, beta blockers are the particular category of drugs where sport-specific rules apply. Now, if you compete in any of the following sports you can see on the screen, these medications are specifically prohibited for you. But there are some changes coming for 2025 to this list of sports, which I will tell you about in a moment. It's very important to know that the many medical conditions that are many common medications that are on the list and are prohibited in sport. Now, here's some examples, and they include things like antihypertensives, which are used for the treatment of high blood pressure, insulin for diabetes, and glucocorticoids for inflammatory conditions and injury, and some of the ADHD medications. But if these are needed for legitimate medical conditions, athletes can apply for an exemption to be able to take them. And David will cover this a little bit later in his section on therapeutic use exemptions. So it's also really important to always remind your doctor that you as an athlete are subject to anti-doping rules and that you would need a TUE in place if a prohibited substance was required for the particular condition that you have. So the rules are clear and the consequences are very tough and potentially career changing. So athletes really need to take this very seriously. So I know you'll be pleased to hear that there's a lot of resources out there to help you. And a very good resource is globaldro.com. Now you can scan the QR code on the screen to find it while you're watching this. Now, if you live in Canada, the UK, USA, Switzerland, Japan, Australia, or New Zealand, you can search for the brand names of the medicines in your countries. But an athlete in any country can look up the status of an ingredient or find links to other international websites that has information specific to your country. So I encourage all athletes to take a bit of time to check this out if you haven't already. The second place to check your medicines is to ask your doctor or your pharmacist. Now, they are experts in medicines and can help you interpret the WADA prohibited list. And many national anti-doping agencies also have athlete advice lines with experts to help with your questions about the medicines in your country. Now, on to the changes to the prohibited list that come into effect in just a few weeks' time on the 1st of January. So now it really is a particularly important time for athletes to check what you are taking very closely. For 2025, we have a new example of a substance in the S0 category of the prohibited list. Now, this is the category of substances with no current approval for human therapeutic use and are prohibited at all times. This class covers many different substances and already includes things like BPC 157, DNP, and troponin activators that were listed in recent years. For 2025, there's two new compounds, S107 and S48168, which is also known as ARM210, that have been added to this section. Now, these are examples of a class of substance called ryanodine receptor 1 calstabin complex stabilizers. They are currently undergoing experiments by pharmaceutical companies to determine whether they may have the potential to treat muscle-related conditions in the future. Now, early studies suggest that these compounds may improve muscle force and help maintain muscle function, which may lead to performance enhancement, which is why these drugs are now prohibited. However, it's important to note that they're not currently licensed for human medical use, so we really don't fully understand the potential risks to athletes if they take these. The next section is the beta-2 agonist section, which contains many medications used to treat asthma and chronic obstructive pulmonary disease, or COPD. Now, these drugs work by relaxing and opening the air passages in the lungs, making it easier to breathe. For the 2025 prohibited list, there's been a new restriction for the medication formoterol, which is a common long-acting asthma treatment. It is now prohibited to use more than 36 micrograms in any 12-hour period, starting from any dose. In addition, the overall maximum of 54 micrograms over 24 hours cannot be exceeded without the need for a therapeutic use exemption. So what does this mean in practice? Well, say you have a product that has 12 micrograms per dose, which many of them do. That will mean 3 puffs or 3 doses as the maximum that can be used over 12 hours. But in addition, you can't use more than 4.5 puffs in 24 hours. So using 5 puffs of that same product would be considered prohibited. I know it's a little bit complicated to understand. Now, some patients may need high doses for their medical treatment, and if they do, they can apply for a therapeutic use exemption to enable them to do so. Now, the reason WADA introduced this new restriction was to make sure that the high doses that may lead to performance enhancement are not taken. And so these regulations really ensure that athletes can be sure that they are competing on a level playing field. I should note that these new 12-hourly dosing intervals are consistent with the manufacturer's recommended use of these drugs. Working out what doses are permitted or prohibited can be really tricky. So I would very much recommend that athletes talk to their doctor or their pharmacist to make sure they get this right. Section S4 of the prohibited list relates to hormone and metabolic modulators, has been updated to include a new substance called MOTS-C. Now, in technical terms, this abbreviation stands for the mitochondrial open reading frame of the 12S rRNA-C. Now, this peptide is still in the research phase, but its effects have been shown to target skeletal muscle and enhance glucose metabolism. There is thus the potential for it to improve physical performance, which is why it's been added to the prohibited list, and it will be prohibited at all times from January. Now, this drug is not licensed for use in humans, although it is already being sold and promoted online for weight loss and anti-aging purposes, even though its effects are not fully validated. Again, there are potential dangers to athletes from these experimental substances, as we just don't know what harms or side effects they may have. The next substance in the hormone and metabolic modulator category are S519 and S597, which are peptides and examples of what we call insulin mimetics. These compounds mimic the effects of insulin, which means they can boost the uptake of glucose in the body. They also have potential anabolic effects, helping to increase muscle mass, and this in combination could lead to performance enhancement in athletes. Now, for these reasons, WADA has prohibited these substances in sport at all times, that is, both in and out of competition. And one more medication in this category to be aware of, elacestrant, which is sold under the brand name of Orserdu, has actions on estrogen receptors in the body. Now, this drug is used in the medical treatment of breast cancer. Athletes undergoing treatment for breast cancer who may need this medication will have to apply for a TUE from the 1st of January. There is a new addition of a medication called zipamide to the section on diuretics and masking agents. Now, this group of drugs are banned because they can dilute the urine and thus hide the detection of other prohibited drugs. Zipamide is an example of a diuretic, which works by promoting water loss from the body. Now, medically, it is used to treat conditions like fluid retention, high blood pressure, and certain kidney diseases. Its primary role is to help the body eliminate excess fluid, which can be crucial in managing these health issues. Now, this prescription medication will be prohibited, or is prohibited at all times, and a TUE would be required if an athlete needs this for a medical condition. Now let's look at the changes to the stimulant section of the prohibited list. This is the category of stimulants are prohibited during the in-competition period only. Hydraphenol is prohibited in sport because it acts as a stimulant. Although this has no legitimate medical use in humans, it's often promoted and sold online, claiming to enhance alertness, focus, reduce fatigue, which obviously can provide potentially an unfair performance advantage. One of the other reasons it is banned is that stimulants pose potential health risks, including cardiovascular issues, making their use in sports potentially dangerous to the athlete's health. Now, this has been prohibited in competition for some time, but it has now been specifically listed as an example in the stimulants category. The next new substance also in the stimulants category is midodrine, which is a medication used to treat orthostatic hypotension, which is basically a sudden fall in blood pressure that can occur when a person stands up. Now, midodrine is in a class of medications called alpha-adrenergic agonists, and it works by causing blood vessels to tighten, which increases the blood pressure. Midodrine is prohibited by WADA because of its stimulant effects on the heart and cardiovascular system, which may potentially provide athletes with an unfair advantage during competition. And that's the reason why it's listed on the prohibited list as prohibited in competition. The next new example is tesofensine, which is a stimulant drug that is sold with claims that it suppresses the appetite and has stimulating effects on the body. Now, this is why it's been added to the list. It is not currently licensed for use as a medication in humans, but it is currently in clinical trials to see if this could potentially be a new weight loss medication in the future. It is sold online as a research chemical, but we still do not know the full effects of this drug in humans. So taking this drug is potentially very risky to the health of athletes. Now, there is some new, very good news for athletes and patients. Previously, plasma donation was prohibited in sport because it involved the reintroduction of blood components. But now, from January, athletes can donate blood or its components, such as plasma, red blood cells, white blood cells, platelets, and even stem cells. These donations are not considered a prohibited method, and so athletes are able to make blood or blood component donations. Some of these donations can be critical and valuable treatment for other patients who need these blood products for some very serious medical conditions. I just want to explain a little bit further the new wording on the prohibited list. It mentions this term apheresis. Now, apheresis is a specific medical procedure that the prohibited list mentions is now permitted as a way of donating blood components. Now, to explain this term, apheresis involves separating and collecting particular blood components, such as plasma, platelets, while returning the rest of the blood to the donor's body. This allows donors to give targeted components without needing to donate all of their blood, making it a very efficient and quite a specialized donation method. However, it is very important to note that there is a key condition that must be met for blood or blood component donation for it to be considered permitted. Now, the key point is that donations must occur in a properly accredited collection center, which is approved by the country's relevant regulatory authority. Now, this might be a government medical or healthcare regulatory agency. Now, this ensures the process always follows strict medical and safety protocols, and it maintains the integrity of both the donor's health and the recipient's care. Now, let's talk about why these donations are so important from a medical perspective. I just wanted to give you a few examples of how blood and blood component donations might be used. Blood transfusions are often needed in trauma cases or during surgery. Cancer patients, particularly those undergoing chemotherapy, sometimes rely on blood or platelet donations in their recovery. And some individuals with blood disorders like anemia or hemophilia often need regular transfusions to stay healthy. Or stem cells from blood donations can be used in life-saving treatments, especially for patients with certain types of cancer. So you can see that this update to the prohibited list will have potentially significant benefits to many patients around the world. And athletes can be reassured that the donation of their blood or blood components will not lead to an unfair advantage in the competition setting. Now, let's go back to that category of beta blockers that I mentioned at the start of this presentation. Beta blockers are a category of medications used for the treatment of some cardiovascular conditions, for example, high blood pressure. Now, WADA has said that based on new information provided by the International Ski and Snowboard Federation, that this category of drugs are no longer prohibited for the skiing and snowboarding disciplines of ski jumping, freestyle aerials or halfpipe, and snowboard halfpipe and big air. Now, the new information that has been assessed has presumably led to the determination that beta blockers do not enhance athletic performance in these specific sport disciplines. Now, it is important to note that not all sports in this P1 section of the prohibited list have been affected by this change. Beta blockers are still prohibited in competition only in the following sports you can see on the screen: archery, automobile, billiards, darts, golf and mini golf, shooting, and underwater sports in all sub-disciplines of freediving, spearfishing, and target shooting. And in addition, they're also prohibited out of competition in archery, shooting, and underwater sports. The prohibited list includes many prescription medications used for the treatment of strong pain. And I just want to take this opportunity to remind you about an important change that happened on the 1st of January this year, 2024, which we still get a lot of questions about. Tramadol has been prohibited in the sport during the in-competition period since January and continues to be prohibited into 2025. Now, tramadol is a common prescription medicine used for severe, painful sports injuries, and it's carried by many team physicians for the administration to athletes for pain in an emergency. It can also be addictive and can lead to dependence if used over a period of time. Now, tramadol may mask pain and was known to have been misused, particularly in sports such as cycling. And a recent study by WADA last year showed that tramadol does actually have the potential to improve performance. And so for this reason, it was banned. Now, this does not mean that this cannot be used medically for legitimate pain relief, but it just means that if you do need this, you will have to apply for a therapeutic use exemption. And if it's needed in an emergency situation, then a retroactive TUE would be needed. David will talk about this a little bit more later on. You may have heard about the WADA monitoring program. Now, this is where WADA looks at laboratory results to see how substances are being used by athletes. For 2025, tramadol and fentanyl will be monitored for how they're being used by athletes in the out-of-competition period. Now, they're currently only prohibited during the in-competition period. Now, this does not mean that they'll be prohibited in the out-of-competition period yet, and it does not necessarily mean that they will be prohibited at all times in the future. But particularly given the addictive properties of these drugs and the potential health risks to athletes after taking them, WADA wants to better understand how these drugs are being used in the athlete community to perhaps better inform future potential decisions about the use in sport, particularly in that out-of-competition period. I just wanted to explain this so that you understand the difference between when a drug is on the prohibited list versus on the monitoring program. Now, just to finish, these are my final recommendations in the run-up to January 2025. So firstly, as an athlete, know what medicines you are taking. Secondly, check that your medicines are not prohibited using either the new 2025 version of the prohibited list or trusted resources like Global Dro. Now, especially now, going into 2025, with all of these changes, you have 1 month to prepare. It's also very important to mention that there are additional risks that apply to supplements, which often cannot be guaranteed as 100% risk-free. Now, the ITA's Athlete Hub on our website and the ITA's YouTube channel has some good advice about the specific risks of supplements and how to make informed decisions on whether to take them or not. Finally, ask your doctor, your pharmacist, or your national anti-doping agency if you're not sure about any of this. So that's all from me. And now I'm delighted to pass the floor to David Healy from the World Anti-Doping Agency to tell you about therapeutic use exemptions. Over to you, David.
Thank you very much, Mark, for that very insightful presentation. And now that everyone has a solid understanding of the prohibited list, I will provide some important details about therapeutic use exemptions, or TUEs for short. Today, I will primarily focus on areas that often cause confusion for athletes, particularly retroactive TUEs and TUEs for glucocorticoids. But first, let's cover the basics. What exactly is a TUE and when would an athlete need one? So a TUE is a medical exemption that allows an athlete to use a prohibited substance or prohibited method for a legitimate medical treatment while competing in sport. But you might ask, why is there a need for such exemptions? As Mark pointed out, many substances on the prohibited list are commonly used to treat everyday medical conditions. Thus, it was essential to establish a process that enables athletes who require these treatments to use their medications without the risk of getting a sanction if they're tested. Now, this process includes strict conditions that must be met, thereby ensuring that it is robust and fair. By implementing the system, we protect the integrity of sport and uphold fair competition for all athletes. We can next slide. Okay, so now you've done the research and you realize that you need a TUE for your medication that you're using. What do you do next? The first thing is download the TUE application form from your anti-doping organization website, or complete it online if that's an option. Next, schedule an appointment with your doctor. And it's important, if you can, don't forget to download the WADA checklist for your specific medical condition. That's available on the WADA website. This checklist will help your doctor provide all the necessary medical information that you'll need to submit with your TUE application. Now, where do you submit your completed TUE application form and your medical file? Well, this depends on your level. You should submit it to your anti-doping organization, and this could include your national anti-doping organization, or NADO for short. An example of these are the anti-doping organizations within your country. For example, in Ireland, it would be Sport Ireland. In the UK, UCAD. In the US, USADA. It could also be your international federation. These are the world sport governing bodies. For example, FIFA for football, UCI for cycling. But again, it's dependent on your sport. And of course, if you're competing in a major event, you may need to submit your application to a major event organizer. This would be someone like the IOC for the Olympics. Again, if you're unsure about your level or where you need to send your application, don't worry. Contact your national anti-doping organization and they'll guide you through the process and make sure you're on the right track. So next, what is WADA's role in this whole process? Now, it's important to remember that WADA does not accept TU applications. As mentioned in the previous slide, that's your own anti-doping organizations. WADA is a regulatory body that drafts the rules, monitors and screens the approved and rejected TUEs. We conduct reviews of ADO TUE decisions and provide education on the TUE process. Okay. So now that you've submitted your application, what are the criteria that need to be satisfied in order for this medical exemption to be granted? Well, first, there needs to be proof of a diagnosed medical condition. Next, we need to ensure that the medication will not enhance the athlete's sporting performance beyond a return to the normal state of health. Next, the medication needs to be an indicated treatment, and if possible, there needs to be no reasonable permitted alternative. And finally, the required treatment should not be due to prior use or abuse of the substance without a TUE. Okay, so now let's move on to retroactive TUEs. While WADA encourages all athletes to apply for a TUE in advance, this is not always possible, especially when athletes require immediate medical treatment. The health and safety of the athlete is paramount, and no treatment should be withheld that will result in an athlete's health being compromised. Thus, a retroactive TUE allows an athlete the opportunity to apply for a medical exemption to use a prohibited substance or method after they have already started the treatment. Okay, so when would you qualify to have a retroactive TUE granted? Well, in these circumstances, WADA has listed 5 different conditions and you only need to satisfy one. We'll start off with 4.1a. This deals with emergency or urgent treatment. Now, emergency is pretty self-explanatory. For example, you could have an athlete who had an anaphylactic reaction. Maybe they're allergic to bee stings and they needed treatment with an EpiPen. Or if an athlete was rushed to hospital with a fracture and needed treatment there. Now, it's worth noting within this clause that the word urgent was added since 2021, as it was recognized that athletes are often prescribed medications or treatments and then advised by their doctors to begin treatment immediately. While technically the situation is not a medical emergency, failure to start the treatment immediately could put the athlete's health at risk. And again, this is not the goal. This is not what we want. We want to protect athletes. Okay, so the next clause is 4.1b. And here the critical element is time. So there was insufficient time or opportunity or other exceptional circumstances. Now, for this, I'll give a kind of an example. So if you consider you have a young athlete who's been diagnosed with ADHD and using medication since the age of 7. Now they're 17, 18, and they're competing in a track event, a local track event. They win the event, and that qualifies them to compete in their national championships the week after. Now, by competing in that national event, they become subject to TUE obligations, which requires them to obtain a TUE in advance. In this scenario, the athlete applied for a TUE, but the ADO didn't have time to process the application. So this is a straightforward kind of example of where this 4.1b could be applied. Furthermore, I'd like to highlight that there is the wording exceptional circumstances, this element of the condition. This criteria allows for some flexibility, acknowledging causes like this where timing constraints are beyond the athlete's control. If we move on to 4.1c, and 4.1c and D are quite similar. Well, they're similar in a way that they deal more with lower level athletes. So 4.1c, in certain circumstances, your national anti-doping organization may prioritize certain sports and disciplines due to resources or other legitimate reasons, and thus not require athletes competing in these specific sports to apply for a TUE in advance. To be clear, these athletes are still considered national or subnational by their national anti-doping organization. However, their TUE responsibilities are different. Only if they are tested and return a positive will they be required to apply for a TUE. Now, WADA recommends that your NADO clearly indicates on their websites which sports fall into this category, thus enabling athletes competing in these sports to really identify if a prospective TUE is necessary or not. And 4.1D, okay, 4.1D, this group of athletes contains all sub-national level athletes. So what is a sub-national level athlete? These are all athletes not captured under the national or international level definition. And you should be able to find those on their websites. Often athletes found in this category are young and at the beginning of their careers. They could be masters athletes or amateur athletes. Athletes in this category who compete in an event may randomly, because of their results or just a random doping control, be selected for a testing. So indeed, a lot of these athletes will likely have very limited to zero anti-doping knowledge or experience. So it's important for the anti-doping organizations to provide clear and concise information after these athletes are tested and guide them with the process. And finally, there's 4.1e, but I'll go into more detail in this in the next few slides. So moving on. This is very important to remember the distinction between whatever of the retroactive criteria and when a TUE will be granted. So satisfaction of one of those retroactive conditions that I just mentioned, it opens the door for a TUE to be evaluated, but it does not guarantee approval. All four of the IS2E 4.2 conditions must be satisfied, and they're the four conditions that I've listed earlier. Okay, so let's return back and let's discuss Article 4.1e, in or out of competition. And you may have heard Mark speaking about this earlier on, as some substances are categorized differently on the list and may be prohibited at all times or only in competition. Okay, so athletes may require out-of-competition treatment using a medication that contains a substance only prohibited in competition. There is a risk of a sanction if traces of this substance exceed the allowed levels during an in-competition test, even if it's used out of competition. If the athlete tests positive in this scenario, the anti-doping organization must allow them to apply for a retroactive TUE. A perfect example of this class, of something that falls into this classification, is a glucocorticoid. If they were taken out of competition, and then it may trigger a positive test in competition. So let's delve deeper into glucocorticoids. What are they? So glucocorticoids are commonly used and are very effective medications for a variety of medical conditions. They are administered primarily for their potent anti-inflammatory or immunosuppressive effects. And they are readily available in various formulations and may be administered via different routes for local or systemic treatment. And if we move on, so it's as of the 2022 prohibited list, glucocorticoids are prohibited in competition when administered via injectable, oral, or rectal routes. the in and out of competition use of glucocorticoids has often been a source of confusion for athletes. To help clarify this, WADA has introduced washout periods to guide athletes and their doctors and reduce the uncertainty about whether a TUE is necessary or not. So what is a washout period? A washout period is a time between the last dose of a substance and the start of the competition period. This period is intended to allow the substance to reduce to levels low enough not to be flagged in testing. Now, I won't go into every route of administration on this chart, but I'd like to highlight that most glucocorticoids have washout periods ranging from 3 to 10 days, with the exception of intramuscular triamcinolone, which may require special attention due to the longer washout period. Knowing whether a specific injection is a 3-day or a 10-day washout or has a 3-day or a 10-day washout period is crucial for proper planning. Okay, let's go into more detail of when you should apply for a TUE now. So the chart here, and it's available on the WADA website, it describes 3 scenarios that may arise depending on whether a glucocorticoid was administered in competition or out of competition, and that's in or prior to the washout period. Each pathway provides guidance on when athletes should apply and when ADOs would process the applications. So if we look first at the far left column, if a glucocorticoid is used during the in-competition period, a TUE is absolutely required and should be requested as soon as possible. Now, if you can veer your eyes to the right, if a TUE is used before the washout period, it's highly unlikely that there will be a positive test in competition, and therefore you will likely not need a TUE. However, I would still always advise to prepare the medical file, just in case. And finally, let's focus on the middle pathway. The out of competition use, but during the washout period. While use within this period is not prohibited, there is an increased likelihood of returning a positive result if tested in competition. To avoid complications, it is essential to discuss this with your doctor. If the use of glucocorticoids during the washout period is deemed necessary, ensure that your medical file is well prepared and includes proper justification for the treatment. This will be very important if you need to apply for a TUE. Okay, so let's put our knowledge into practice in an example case. Here we have a 30-year-old rugby player with acute pain in his shoulder. They're due to play in a rugby sevens tournament over the next few days. The player has a history of rotator cuff tendinopathy, bursitis. They recently had an intense flare-up after training. The pain's hampering his sleeping, training performance, and he's tried the non-prohibitive alternatives. He's tried the non-steroidal anti-inflammatories, but they're not effective. His first game is in 48 hours, and his doctor plans to administer a short-acting, let's say, betamethasone injection into the bursa. So we'll see, let's move on, and we'll see what would you do? So we have a quick poll question here. So does the athlete need to apply for a TUE before or at the time of injection? And let's, if everyone we can get everyone's opinion on this. Now, while people are voting, I'd just like to make a quick note that the success of any TUE application rests upon the quality of the accompanying clinical justification. Therefore, all treating doctors are strongly encouraged to keep full and accurate clinical records, including the time and dose of administration when treating athletes liable to doping control. Even when the even when the administration of the glucocorticoid was out of competition. Okay, let's see. I'm still waiting for the answers to come true. Okay, so I'm having a bit of issue seeing the answers, but I'm going to give you the answer now anyway. So in this scenario, okay, so most people have voted yes. Okay, well, actually, the technical answer is no. It's not mandatory for the athlete to apply for a TUE at that time or at the time of injection or before, because the athlete is using it out of competition. It's only mandatory for an athlete to apply for a glucocorticoid TUE if they're using it in competition. So in this scenario, the athlete would only need to apply if they tested positive. Now, remember, some ADOs, now in some scenarios, depending on whether your anti-doping organization is willing or has the capacity to evaluate the application in a short time frame, you may be able to get an answer before the competition. However, it's not possible in most cases because there's usually, in this case, you have 48 hours before the athlete competes. Thus, it's vital, and as I already mentioned, you really have your medical file prepared, and if it's well justified, there should be no issues. And you can always apply for a retroactive TUE under Article 4.1E. And this is usually only if there's a positive test. So the answer was no, if people are still looking. I see some of the comments. And let's move on to the finishing up. Some of my key points here is just for the athletes listening, is always, as Mark mentioned as well before, be informed, be diligent, do your study in the background, make sure that any substance you're taking, even if there's if it's a combination medication, make sure you check both medications in it. And always don't hesitate to reach out for guidance, whether that's to your anti-doping organization, your local pharmacist, or whoever it is. And finally, I'll just leave you with some resources available on the WADA website, the checklist and the guidelines. And of course, we have the Adele platform. And thank you very much for your attention today.
Thank you, David. And as we approach the end of today's session, I want to highlight the resources that you will see also on the next slide that we have compiled for you. These materials will provide additional insights on the topic that we just discussed. And of course, you will receive a copy of the slides so you can revisit the materials at your convenience. Now, let's move into the live Q&A, and this is your chance to ask any questions that you may have about today's presentations. And both Mark and David are here to share their expertise, so please feel free to continue sending your questions, and we will cover as many as time allows. So welcome back, Mark and David, and thank you both for such an insightful presentation. We will now dive into the questions that have been submitted through the live session. And first, of course, I would like to thank everyone who submitted the questions. Mark, we have very interesting questions from our attendees. May I hand it over to you?
Thanks, Armando. Yes, some really good questions there. I've written a few down here. I'll cover as many as I can. David, maybe while I'm answering these first few questions, you could go through that list, and there's a few specific to TUEs. Maybe you could take those, but I'll make a start. So there's a question from Sophia asking about IV infusions, whether they're prohibited or not. They are prohibited. So the IV infusions or injections are prohibited if the volume is over 100 mils given over within a 12-hour period. And the reason for that is that the IV infusions can change the composition of an athlete's blood. And that makes it more challenging when doing a blood test on an athlete. in terms of detecting potential prohibited substances that may be in the bloodstream. So in a similar kind of way that, diuretics alter the urine concentration, infusions can also alter the blood composition. So that's why they're prohibited over 100 mils per 12 hours. Sophie, another question from you about CBD and your question was, is this prohibited or not? So CBD or cannabidiol is not prohibited. Now, WADA has got some really useful information on the Q&A section of their website, and they go ahead and they actually give us a bit more guidance around this, and they say that some CBD oils may contain THC, which is a prohibited constituent of cannabis, or it could also contain other cannabinoids that are prohibited, that could result in a positive test for a prohibited cannabinoid. Now, if it's very pure, CBD itself is not prohibited, but potentially some of these products, would have some of these other cannabinoids in there that are prohibited. So can be a bit of a risk and a few things for athletes to think about there. Check out the WADA website for a bit more information on that. Andre, there's a question there about carbon monoxide use and whether that will be prohibited in the future. What I can say about that is it's currently not prohibited, use of carbon monoxide. It's a very dangerous practice, and no athlete should actually be using carbon monoxide in any case. But it's not currently prohibited. It's not listed on the prohibited list. I can't comment whether WADA is investigating this in the future, but I can say that it's currently not prohibited. Syed, you ask about PRP. Is that prohibited or permitted? Now, PRP is platelet-rich plasma. And WADA has said also on the Q&A section of the website that this is not prohibited. Wendy, you ask whether, in terms of blood donation, whether there's a list of collection centers that are approved. To my knowledge, there's not a list, a definite list, but the prohibited list does say that any collection center where these donations of blood or blood components are done have to be accredited by the regulatory authority in the country where it operates. So if you're deciding, trying to work out if a donation center is accredited, you need to really look at that and see, is that actually accredited by the regulatory authority in that country? So it might be a medical organization, it might be a government, medical department that accredits those collection centers. So that's the definition that WADA has given us on the prohibited list for 2025. Hyo-chan, you've asked for clarification about blood donation versus blood transfusion. Now, I mentioned before the blood donation is permitted. It should be very clear that blood transfusion, that is giving blood to an athlete, is strictly prohibited. So really do check that out. There is a clear difference between donating blood or blood components to actually receiving those blood. Receiving that for an athlete is very much prohibited. Milena, you ask about hypoxic chambers. Now, hypoxic chambers are not prohibited on the prohibited list, but it's important to know that at some sporting events, such as the Olympic Games, the use of hypoxic chambers are prohibited by the rules of that particular event. So the IOC says hypoxic chambers can't be used in the Olympic environment in association with the Olympic Games. So in terms of use of hypoxic chambers, just always check the rules of your event or your federation to find out what their rules are in terms of the use of that. But they're certainly not listed on the WADA prohibited list. Oliver, you ask about the scientific criteria to define whether a substance is performance enhancing. Now, now the criteria, there can be quite a number of ways that performance enhancement can be determined for a particular substance or a drug. And sometimes this information comes from clinical studies of the drug while it's been in development for human use. Potentially specific studies that have been done in athletes to see if they have any performance enhancing effect. Potentially studies in animals that have shown a potential for performance enhancement. Or that it may be that that is assessed based on the known effects of a particular chemical or drug, based on the structure of that molecule or the structure of that drug. So this evidence can come from a variety of different places. There's not one exact, criteria to determine performance enhancement. It can be a mixed set of information. Milena, you asked about the monitoring program and whether the things on it are prohibited. The drugs or substances on the monitoring program are not prohibited yet. So they may become prohibited in the future or not. Some things go onto the monitoring program. They stay on there for a while to give WADA information about how they're being used by athletes. Sometimes they will just come off the monitoring program because WADA has gathered the information they need from that. Sometimes that information will lead to that drug going onto the prohibited list. But the important thing is, if something is on the monitoring program, it doesn't mean it's prohibited now. So again, check out the WADA website. The monitoring program for 2025 is published on the WADA website now. And my last question before I hand over to David, there's a question there from Ricardo asking what amount of prohibited drug is needed to test positive. Now, this is a bit of a mixed answer as well. Now, for some drugs, any trace of that particular substance that's picked up during an anti-doping test can result in a positive test and an anti-doping rule violation. For other substances on the prohibited list, there can be a threshold by which anything above that threshold is considered a positive test and would lead to an anti-doping rule violation, and anything under that threshold wouldn't be reported necessarily by the laboratory. So it does make a difference between different substances on that prohibited list, but many of the things on the prohibited list, even just a trace of it in your body, can result in a positive test. So I hope that answers that question. David, I don't know if you had a chance to have a look at some of those TUE questions.
Yes, Mark, I can quickly go through a few.
Great, over to you.
Mm-hmm. Yeah, thank you. So Kifa in the chat said, if a medication is prohibited in competition only, but the athlete needs to use it every day, should they apply for a TUE? Yes, that in this circumstance, it's recommended you apply for a TUE. And a common example of this would be an athlete who is using stimulants for ADHD treatment. They're going to have to use the medication every day. So it's WADA recommends that you apply for a TUE to use at all times, and it can cover you for whatever period that your ADO grants it. Next, I have a question from Angelica. It's, can you explain how the retroactive request would fit in the 4.3 criteria? Article 4.3, I didn't touch on it in this presentation because we could have a whole other hour-long conversation on it. But basically, Article 4.3 is an exception to the criteria listed. As I mentioned, we have 5 retroactive criteria that WADA have created, but it doesn't cover all scenarios. So we created an exceptional clause called Article 4.3 and we call it the fairness clause. So it only applies in really exceptional circumstances when an athlete, for whatever reasons, didn't satisfy any of the 5 retroactive criteria, or even if they didn't satisfy all of the 4.2 criteria. So it's a very special clause, and one that should really only be applied rarely, but it's there as a safeguard to protect athletes who are using medications for legitimate medical reasons, and for whatever reason, what didn't apply in time or didn't get the proper information. Next, I see there is one. It's jumping on me here. I seen one. If an athlete comes out with an adverse analytical finding for tramadol, but the medication was used in the washout time, is a retroactive T requested in this case? Again, I'd like to point out the washout period for tramadol is 24 hours. So if the athlete has used it in this period, if they don't test positive in competition, there is no need to apply for a TUE. However, if there's a positive test, yes, most certainly you will have the ability to apply retroactively, and you can do so with your ADO.
All right. Well, thank you very much, David. Thank you, Mark. I believe we are running out of time, so let's wrap up the session. But before we close, of course, I want to extend our thank you to both you, Mark and David, for sharing your time and your expertise with us today. If we didn't get your question today, or if you have further questions later on, please feel free to email us at education@ita.sport. As we close, again, on behalf of the entire education team, I want to thank each of you for attending. We hope that you found the session helpful. And just a quick reminder that we will be emailing the presentation slides to you very soon. And after the session ends, you will be redirected to a survey. Thank you once again, David, for your time and for your expertise. Thank you, Mark. And thank you once again, everyone who joined us. And thank you for keeping sport real. We look forward to connecting with you soon. Thank you.
Thank you very much.
Thank you, Amanda.